What is going on, everyone? Thanks for tuning in to another episode of Forward Thinking Founders. I am very grateful to have your attention, at least for the next 15 minutes of this episode. Forward Thinking Founders is a podcast where I interview pre-seed and seed stage founders about their products, what they want to build into the world, and why. We dive into how they spend their time, what's their vision, what's the origin stories, all these things, so you can learn all about what's coming tomorrow. Because these companies haven't hit critical scale yet. Most of them haven't hit product market fit. These are just early stage companies, and the big question is, what can this be? And in this podcast, we bring that out. So with that, I really hope you enjoy your time listening to today's episode. And I've already done 200 plus, so if you like this one, listen to some of the other ones, like with Imadi Kund, Austin Allred, Leah Culver. We have great interviews, so check it out, enjoy the repository, and for now, let's get into today's episode. Here we go. All right, how's it going, everyone? Welcome to another episode of Forward Thinking Founders, where we talk to founders about their companies, their visions for the future, and how the two collide. Today, I'm very excited to be talking to Adi Diner, who's the co-founder of iFocus Health. Welcome to the show. How's it going?
Great. Thank you for having me.
Yeah, I'm excited to have you on, and I'm looking forward to learning more about what you are working on. For people that haven't heard of your company, what is iFocus Health?
So we're trying to solve a huge problem that everyone that has ADHD is facing, which is how do you measure? How do you measure progress? How do you know that your treatment is working? And we're doing it simply by using your webcam and tracking your eyes.
So I'd love to hear more about kind of how this works. If I was to kind of be a user of the product or customer of the product, what would I experience if I were to try it out?
So it's simply install and run in the background on your computer. And then in the same way that if you had diabetes, the doctor will get a report of how your glucose levels are going along the day. Our product will just track your eyes, see reading patterns, basically, and get the doctor a report of your progress. So we are comparing you to your baseline and how you're improving.
And tell me a little bit about kind of why you got started with this. What's the origin story for iFocus Health?
Yeah, it's actually quite funny. In my background, I'm a physicist. I did hardware development and lasers and stuff like that. And I was not even trying to become a founder. But then my son was diagnosed with ADHD, and I was driven crazy by the lack of data. Everything is perception and questionnaires, and there's lots of misconceptions and opinions. And the best way to battle that is to get data. So I was looking for a way to actually make a measurement. And when everyone went on Zoom for school, we realized that the reasons the teachers can't know if the kids are following is they can't see the kids' eyes. So that's got me looking at some research in these topics. And the connections between our eyes and cognition is well established. And there's products out there dealing with diagnosing concussion and dementia and other things. But ADHD hasn't been tackled really because it's complex. So we're looking for a complex process, not something that is just trigger response. And that's how we came across reading.
As you work on the company, I'm curious, like, what do you spend your time on? Like when you wake up tomorrow, like, where's your focus go?
So right now I'm spending my time on two things. We're going to release our first MVP in the next few days. So we're testing that and making sure it works. And then we'll start collecting data to establish our AI algorithm. And the other part is raising funds, right? That's what the CEO does all the time.
Yep, that's right. And I guess one other question, since this is a hard problem, right? I mean, I think hard problems are the most interesting problems. What have you learned so far about building this company? Whether it be about product, market research, what about just some things that you've learned so far?
Gosh, I learned so much because this is not my field. So from learning tons about ADHD, I'm just researching it and learning all the time. And I'm fortunate to be able to help people in my community because people keep reaching out. People are so lost that they keep getting questions, and I'm happy to try and help. To a lot of things about our healthcare system. Some are not so positive, as we all know. The other part that was a positive thing is I've been talking to a lot of clinicians and researchers, and they're so open for this idea. I was actually positively surprised. I was expecting them to be reluctant for change, and especially for a change coming from the outside.
Yeah, that's That I'm learning that the hard way too. It is people, yeah, change is not change and normalcy doesn't go together. And but it takes people with a different perspective to make the change, right? And then of course everyone realizes they were right the whole time. But I'm
So
curious, if you go
yeah, sorry.
forward, if you go forward like 5, 10, 15 years, when like everyone realizes that you were right and this is what's needed, I'm curious, what does the company look like then? Or in other words, what's the big vision here and what direction are you rowing in?
So there are two things. The big vision first is for this to be trivial. Of course, if I have ADHD, I'm using a tool to know that it's working, right? Everyone should be able to use this. So that's the vision for people and for how I want to change the field. In terms of where the company is going, there are so many directions we can go with this. The data will change the way ADHD is understood. We can be also a tool to help behavior feedback, which is very hard, very expensive to get any other ways. So there is a tool that knows how you're doing. It can give you feedback. So that can go in many different directions. And the way digital health and virtual health is going, gosh, getting another tool that is real life measurement is just, it's hard to imagine how far it can go.
Absolutely. And I mean, in order to kind of make it happen and make the vision come to life, you'll need some help, right? So I'm curious, how can the forward-thinking founders community help you kind of make the vision happen? Are you hiring, raising money, looking for beta testers or customers? How can we assist?
So I'm starting to collect beta testers now. I suspect I'll have more than enough, but I'm always happy to get contacts for people that are interested to join. I am raising money right now. So that's another direction. And anyone that has connections with clinicians that might be interested to collaborate with us, that's also great.
And then if someone wanted to learn more, kind of help you out with one of your asks or just kind of check it out, where can they find you online? Do you have a website, social media, email?
So the website is ifocustest.com. And my email is adi@ifocustest.com. So that's not hard. I'm also on LinkedIn. You can find me Adi Diner. So I'm pretty easy to find.
All right. Well, thank you so much for coming on to the podcast. I really appreciate it.
Thank you very much.